Hey guys, Chris here with MP Sparkles and welcome to my channel. Today, as promised last week, is going to be part one of a series of videos that will cover everything you need in order to report or update the healthcare provider when a patient has an issue. This will be a general video on all of the things that you are going to need when it's time to update the healthcare provider, whether it's an MD, an NP, a PA, it doesn't matter. You will have the necessary things ready to go, and then we will be asking you the questions. And of course, if you can anticipate what we're going to ask, it'll make your life much easier. So we will cover a few of those things. And then at the end, I would like to talk to you about assertiveness. And what I mean by assertiveness is I am sure either you have been or you will be verbally abused or mistreated, or somebody's going to be pretty abrasive with you when you're giving report or updating. Unfortunately, just like you guys are extremely busy, so are we. So if I get a phone call and somebody doesn't have their stuff together and I start asking questions and all I hear is hold on, let me look, and then you hear the scrambling of the paper, and then you ask another question, and then you try to be patient, and then you hear, well, the computer's so slow, oh my goodness, hold on. It just taps on some nerves. It's not to be mean or to be rude, but we just like things to be nice and clear and transparent. So when you're updating the healthcare provider, accuracy is also very important. You don't want to start the story, well, there were the other day. Just get to the point. What is the problem and what can we do to help? So you tell us the problem and then we will give you some order. The important things to have, of course, name and date of birth are first and foremost. As far as date of birth, obviously, this happens mostly when we're calling on-call providers because they're not familiar with the patient. If I tell you to draw some labs or to check on something, when you call me back, obviously I don't need the date of birth. This is my patient and I know them very well, if that makes sense. The more useful information you have, the faster we can think and try to formulate at least a hypothesis with differential diagnoses of what the patient could be going through, what the problem could be, and how to solve it. I would recommend, in order to be well organized, that you print a set of vials at least for the past couple of days. Take 2 sets for yourself. So you take 2 sets, you take the first set, you wait 30 minutes, unless of course it's an emergency. If they're short of breath, chest pain, anything that requires something urgent, just get 1 set of vitals. But if you can, get 2, and please manually, manual blood pressure, manual heart rate. It is really important for us to know that because machines make plenty of mistakes, plenty of times. The patient could be hypotensive. The machine says he's fine. That's a whole different thing than if we know he's hypotensive, we might want to send him to the emergency department right away. If symptoms started on a previous shift, if you are day shift and the night shift says they start acting strange or something happened, please ask as many questions as you can. If the nurse leaves in a rush, then please look at her charting to see if you could get as much information as possible so that when you do the update, you have that information with you. Also, if you can, please print out a copy of their last labs. You never know. They might be asking you that and you just don't want to go digging in a chart or on the computer. So now let's talk about the patient. This is your patient. Your patient is having a symptom, and we're just going to talk general guidelines, a symptom. Now, if the patient has pain, we want a description of what the pain is like. What does it feel like? Is it a sharp pain? Is it dull? Is it cramping? Does it come and go? Is it constant? And does it go anywhere else in the body, or is it just localized to one area? Next thing we want to know is, what were they doing prior to having this pain? So were they sleeping and the pain woke them up? Were they exercising? Were they eating? Were they drinking something? Were they going to the bathroom? We always have to see what happened prior to the pain, just so that maybe we can get an idea of what is really going on. And then we also find out what makes it better or worse. So if they can't get up because something really hurts, or if they're relaxing, then they have no pain, but when they do something, they have pain. We have to find out if there's anything that makes it better. Do they feel a chest pain and then when they drink water, it's better? So that might just be GERD and not real chest pain, but that is certainly a question that we want to assess, is it's really important. And then we want to ask for how long the pain lasts, of course. If it's a matter of pain, for how long has it been lasting? Does it last the whole time? Does it last for 5 minutes and then it comes back? Like I said, gather as much information as you possibly can. Sometimes they're not able to tell you if it woke them up from their sleep, but their roommate might be able to tell you, yeah, they've been moaning half the night or something like that. Take that into consideration for sure. So after you've gathered all of your facts and all of your information, now you can place the call to the healthcare provider, and it will be concise. The patient is complaining of pain. This is when it started. This is better, this is worse, it doesn't go anywhere else, it's just localized. They're vomiting and they have diarrhea. They're also complaining of abdominal pain, it's cramping, and the stools are very loose or liquid. That already makes us think, I wonder if it's C. diff. We'll think about it. So then we might tell you, okay, let's continue to monitor, and then if the patient is still having loose stools, give me a call back, and then we'll send the stool for testing, for example. I'm skipping around, but just to give you an idea of what the different things that we might be asking you are, because it's important for you to at least be prepared. And last but not least, now you need to practice assertiveness. Practice with your friends, practice with your family, practice with your kids. Just tell yourself that you are the most important in this whole circle of healthcare, because you stand in between the patient and the healthcare provider. We need you and the patient needs you. So you are very important. Without you, we would have no idea what's going on with our patients. You need to keep that in mind at all times before calling the healthcare provider in case you get something like this. With that said, if the doctor or the nurse practitioner, whoever, treats you unkindly or insults you, they're abrasive, they're rah, 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 they're mad at you, let them unleash a little bit, and then you tell them, please do not talk to me that way. I am calling you because I have concerns about my patient, who is also your patient, and I'm trying to do the best I can to give you as much information as possible. So I do not appreciate you being abrasive. It is not my fault. I am trying to do my best. If you want to hang up the phone and call me in 5 minutes, that is fine too. But please treat me with respect. And that is what you should do. I know it's hard. You think, oh my God, if I did that, you know what? Tell yourself one simple thing. At the end of the day, when we all remove our lab coats, our name tags, we are all the same. If you saw an orthopedic surgeon or a neurosurgeon in the grocery store, you wouldn't even know it. To you, it's another person who maybe is standing in your way in the aisle while you're trying to pass with the cart. So keep that in mind. You are no less important than anybody else. If you're shy, this job will definitely teach you some thick skin. Do practice, whether it's with your management, whether it's with your colleagues because they're not treating you kindly. You have to speak your mind in a kind way. You have to let people know that it is just not okay to treat you that way. You are not a doormat, and you are not there to get abused. You are there to give the patients the best care you possibly can. Does that make sense? I hope it does. And last, you are an advocate. You are the patient's representative. You are their lawyer. You are the person that has to make sure that they are safe at any time. So tell yourself that and represent these patients. Demand the best care, not only from yourself, but also from other providers and people taking care of these patients, because they are very important. Now, when a provider gives you an order, repeat it out loud, always, to make sure you said the right thing, and write it down. And then when you document in your own record, document everything that you did, document what symptoms the patient was having, document you spoke with the physician, these are the orders, because you know that if you don't document it, you didn't do it. So give yourself credit by writing it down so that everybody knows what you have tried to do for this patient. And if the provider says to you, send them out to the hospital, you call the emergency department with the same report. So you can talk to a nurse or you can talk to a doctor, whoever will answer, and then you tell them what is going on with the most important thing first. Like if they have shortness of breath and pain in one hand and they're dizzy, just start off with shortness of breath first, then the dizziness, then the hand, to make sure that they on their end document it correctly too, because sometimes we talk, and then when I look at the documentation on the emergency department part, I see that the problems the patient was having in the nursing home are half of what was written there. So somewhere in between, there's a discrepancy between the report we give and the report other people take. So my friends, I hope that this video was useful. I hope that you were able to learn something and take away something for your practice. And I'm really excited for next week, because next week we are going to cover part 2, which is going to be chest pain. Chest pain is a big one. There will be a lot more detail and everything that correlates with that. I will still show you what you need to have, what is really important to have, and how to report it off to a healthcare provider in order for everything to go smoothly. And exercise, practice, and give good care. Be an advocate and know that you are very important and you matter more than you could ever know. Have a great day, everybody.